Good day, everyone. In the next 15 days, as Baguio remains under enhanced community quarantine, it is imperative for us to persevere even more to keep the dreaded COVID-19 out of threat. Let us protect ourselves to save lives, ours, our loved ones, and others. Kailangan pa natin palakasin at pabilisin ang ating mga isinasagawang pag-iingat upang hindi tayo mahawa at makahawa ng iba. Sa patuloy natin pag-iingat at sa awa ng Diyos Ama, kaya natin lagpasan ang sakit na ito. Where are we right now? As the enhanced community quarantine in Baguio is now extended, along with other key regions, provinces, and other cities in Luzon. Admittedly, we strongly lobbied for a localized ECQ, hoping that selected capable LGUs will be allowed to manage their own situation. We failed to secure the green light, but without question, we welcome it just the same. Confident that in a few weeks, Baguio will eventually transition from ECQ to GCQ. The big questions that we face continue to beset us. Can our economy handle an extended, enhanced community quarantine? Are we ready, and I'm referring to government, private sector, and the community, to endure further the difficulties inflicted to businesses, jobs, and livelihoods? In the event that Baguio gets the notice of reopening the closed sectors of our economy, are we ready with all the measures to keep our people away from harm and mitigate exposure to the risk caused by this deadly virus? To answer these questions, let us walk through briefly on where we stand right now. At present, we have 30 confirmed cases. In the last 6 weeks, only one fatality was reported. She had an underlying condition. 13 patients have recovered so far, while 16 are still confined. I learned that all 16 are showing favorable signs of improvement, and I am confident that they will recover in due time. Lately, however, over the past weekend, the Baguio General Hospital and Medical Center reported that 11 health workers, 3 doctors, 4 nurses, 3 nurse attendants, and 1 hospital clerk were diagnosed with infection. These unfortunate incidents further strengthened our resolve to provide those in the active front lines of medical treatment the utmost protection they fully deserve. BGH has already implemented strict precautionary measures to stop the spread of the virus. Contact tracing has since been escalated to give us the head start in detecting others who were in close contact with our infected hospital frontliners so that they can immediately be isolated and quarantined. Just the same, we cannot afford to relax and be complacent despite Baguio's label as a model city in the battle against this novel coronavirus. This enemy is unseen, unpredictable, and can spread rapidly in all sectors of society. Let this be a lesson to all of us. Unless we know the real COVID-19 situation in the city, we must always be on our guard. Just like in the battlefield, situational awareness, that is, knowing the situation on the ground, is key to good decision-making to win the war. Similarly, we need to conduct extensive testing of our health workers and those in the high and moderate risk category to determine our present condition. We have already ramped up our testing capacity to 200 plus, and we will increase it further to 300 or 400 in the next few days. Along this line, we are making substantial progress in securing more rapid test kits and PCR-compatible test kits for the city. Moving forward, we have collectively gone way ahead in planning our exit from ECQ status. For the past 3 weeks, we have been in dialogue, consultations with various industry leaders and representatives in health, education, tourism, business, trade and commerce, manufacturing, transportation, BPO, construction, and arts to listen to their views and insights which will be incorporated in our transition, recovery, and resiliency plan. We simply have to develop a strong sense of ownership and involvement in the formulation of these plans. I cannot overstress that alignment is key to successful execution. What we have principally arrived in consensus with key sector leaders will be done in gradual, calibrated sequence. First, Allow construction and building activities in both government and private settings. Second, open up government operations in key economic sectors. Third, resume public transportation and activate mobility from point to point under reduced occupancy. Fourth, gradually reopen restaurants, small establishments, and small retail shops business under the same very strict health protective conditions and standards. And fifth, allow events for scaled-down entertainment, family-oriented activities, and worship gatherings. We are confident that this transition action plan, crafted collectively by government and private sector, will decisively lay down a strong foundation towards economic recovery. Babangon tayo ng tuluyan. But make no mistake about it, even under reopened economy, we have to adhere to the new normal. We will remain obedient to the very strict observance of social and physical distancing, wearing of face masks and hygiene practices. We cannot afford to compromise health and safety considerations. And as we do so, resumption and easing up on the various sectors will have to take place gradually, baby steps, so to speak, so that when we are faced with serious health issues and problems, we can make all the necessary adjustments and changes with ease and speed. Nasa atin sa Baguio ang kakayahan ng pagpapatupad ng localized quarantine habang unti-unti nating ibinabangon ang negosyo, habang dahan-dahan nating ibinabalik ang trabaho at sa bawat hakbang ay magkaroon ng bagong livelihood opportunities sa ilalim ng isang pamamahala na may tapang at malasakit sa gitna ng krisis na ating kinakaharap. Words of thanks will never be enough for the fine, brave, and courageous work selflessly rendered by our frontliners just in the health sector, but everyone who made possible what we are now, including countless donors who have helped us most meaningfully. Salamat ng marami sa buong pagkukusang suporta upang lahat tayo ay maging ligtas. Sa patuloy na suporta at biyaya ng Diyos, ihilom at babangon tayo. Aangat tayo, Baguio. Salamat ng marami sa inyong lahat. Amid unsettling times, now is the time to continue demonstrating how we can be better than the best in us, working as one, healing as one, and winning as one. With our loving God on our back, we shall overcome.